Welcome to 10-Minute Health Tech, the AI-powered podcast, where today we are debriefing from the week at the 2025 Vive Health Tech Conference in Nashville.
It was buzzing.
Yeah.
With energy and a sense of momentum around AI,
Yeah.
cybersecurity, and health equity.
I'm Anthony, and this was my first Vive.
Oh, wow.
I was blown away by the sheer scale of it. Over 8,000 attendees, 700-plus vendors. It felt like the entire health tech world descended on Nashville.
And I'm Julia. It's great to be back with you all to unpack what really stood out from all that noise.
It was impossible to miss the AI buzz. Last year, it felt like a lot of hype. But this year at Vive, we saw real-world applications and tangible solutions emerging.
That shift towards tangible solutions is key. One of the most fascinating aspects was the rise of what they're calling ambient intelligence, particularly in Microsoft's presentations. Think of it as AI that's seamlessly integrated into the environment, almost like a helpful presence rather than a separate tool.
So instead of doctors and nurses having to interact directly with AI systems, it's more about AI working in the background, anticipating needs, and providing support.
Precisely, Microsoft's senior VP Joe Petro really drove this point home. He emphasized this vision of AI as a co-pilot, not a replacement for human interaction. Imagine AI subtly assisting with tasks, reducing clinician burden, and ultimately enhancing patient care.
It sounds almost futuristic, but they actually shared some impressive examples of this in action. What was it they said about Dragon Medical?
Right. They talked about the years of intensive work they put into making Dragon Medical, their ambient listening tool, incredibly accurate. Apparently, it's nearly error-free, now having been trained on millions of hours of physician-patient interactions.
That's pretty remarkable, considering all the challenges we've heard about with these large language models. Remember all the talk about GPT-4 being too complex to customize for healthcare? Seems like Microsoft is proving those naysayers wrong.
They absolutely are. Petro shared that in just 11 months, their generative AI tool went from 0 to being used by 600 health systems. That means almost 500,000 physicians are now utilizing it. Such rapid adoption definitely suggests they're onto something.
It's not just about passively listening anymore. They're extracting real intelligence from these interactions to improve workflows and patient outcomes.
Exactly. For instance, they highlighted the Mayo Clinic's success with Abridge, an ambient nursing documentation tool. Imagine nurses being freed from the burden of constant documentation, allowing them to focus more on their patients.
I remember hearing the Mayo Clinic's chief nursing officer talk about this. Her vision is for nurses to not have to document at all, which is pretty radical.
What's fascinating is that this approach goes beyond efficiency. It's about empowering nurses to nurse out loud, having more natural conversations with their patients, and capturing those interactions to improve care quality. It shifts the focus back to human connection, which is essential in healthcare.
It pushes back against the narrative of AI replacing healthcare workers, which we hear a lot. What we saw at Vive was more about AI augmenting human capabilities, making us better at what we do.
And this applies not just to clinicians, but to patients as well. The reality is that patients are already using AI in their health journeys, whether it's through tools like Google for research or even ChatGPT for a second opinion.
You're right. People are going to seek out information and resources, and it's up to healthcare organizations to adapt and integrate AI responsibly to meet these evolving expectations.
This theme of responsible AI integration was really prominent throughout the conference. We'll definitely need to dive deeper into that later.
You got it. But before we get ahead of ourselves, there's another application of AI that I found incredibly intriguing, its potential in healthcare education.
Oh, absolutely. Imagine a world where nursing students can practice handling rare or complex situations in a safe and controlled environment through AI simulations. This could significantly enhance their skills and competency, leading to better patient outcomes down the line.
That's an exciting prospect. But it also raises questions about how we ensure these simulations are realistic, accurate, and prepare students for the real-world complexities they'll face.
Valid points. There's a lot to consider as AI becomes more deeply embedded in healthcare education, but the potential benefits are definitely worth exploring further.
Okay, so we've touched on the tangible impact of AI, its integration into workflows, and even its potential in education. It's clear this technology is rapidly evolving and permeating every aspect of healthcare.
And it's only going to become more prevalent in the years to come. What I found particularly interesting was how the conversation at Vive moved beyond the type of AI to really grapple with its responsible implementation and ethical considerations. We saw this in discussions around health equity and cybersecurity as well, which were major themes at the conference.
That's a great segue. Let's shift our focus now to those critical areas. Starting with health equity, it wasn't just lip service at Vive. There were genuine discussions and tangible approaches being presented on how to close care disparities.
What struck me was the idea that prioritizing health equity can actually accelerate overall improvement in healthcare systems. By focusing on the needs of underserved populations, you often uncover systemic issues that impact everyone.
It's almost like solving for the most challenging cases forces you to find solutions that benefit the entire system. It reminds me of something Dr. Lakshmi Halashamani of Endeavor Health said during her presentation. We're not going to improve and then focus on health equity. It's through making the care equitable that the care will improve faster.
Exactly. And her point resonated throughout the conference. It's not just about doing the right thing, it's also about making good business sense. By closing disparities, health systems can improve their overall performance and create a more sustainable healthcare ecosystem.
This brings us to another crucial aspect of that. Community engagement. Dr. Halashamani stressed that it's not enough to have good intentions. You need to actively partner with community organizations and leaders to understand the specific needs and perspectives of the communities you serve.
And most importantly, you need to listen. Healthcare organizations need to approach these partnerships with humility, recognizing that they don't have all the answers. The real insights often come from the people who live and work in these communities.
It's about understanding the lived experiences of those who are most impacted by healthcare disparities and working collaboratively to develop solutions that address those needs.
Absolutely. It's a shift from a top-down approach to a more collaborative and community-driven model of care.
Okay, we've covered a lot of ground in this first part of our deep dive, from the rise of ambient intelligence to the importance of health equity and community engagement. There's still so much to unpack from Vive, particularly around the critical topic of cybersecurity, which was front and center in many discussions.
Indeed. With the anniversary of the Change Healthcare cyber attack still fresh in everyone's minds, the sense of urgency around proactive cybersecurity measures was palpable. We'll delve into that and more in the next part of our deep dive.
Stay tuned, because we've got a lot more insights to share from our time at Vive 2025.
Welcome back to 10-Minute Health Tech.
Let's dive back into our debrief of the Vive 2025 Health Tech Conference.
Yeah, we were just discussing the importance of health equity and community engagement. One of the most compelling presentations I saw actually showcased how focusing on those furthest from the goal can accelerate improvement across the entire healthcare system.
You're talking about Dr. Halashamani's session, right? The one where she argued that focusing on the groups with the worst outcomes can actually lead to faster overall progress.
Yes. She made a powerful case that tackling the most challenging cases forces you to identify and address the root causes of inequities, and those root causes often have a ripple effect across the entire system.
It's like a rising tide lifts all boats. So addressing disparities for some ultimately benefits everyone.
Precisely. Think of it this way. If you can figure out how to deliver high-quality care to a population that faces significant barriers like those in rural areas or with limited access to transportation, you're likely to uncover solutions that can be applied more broadly.
So it's not just about focusing on those with the worst outcomes for the sake of fairness. It's actually a strategic approach to improving the system as a whole.
Absolutely. And it ties in perfectly with what we were discussing earlier about community engagement. You can't just assume you know what's best for a community. You have to partner with them, learn from their lived experiences, and develop solutions together.
Dr. Halashamani had a great quote about that. We have to connect with our community organizations and focus on what they believe is important to the community. It's a reminder that healthcare organizations need to listen more than they talk.
Right. And she shared a great example about a hospital struggling to improve blood pressure control in a particular neighborhood. They partnered with a local church that had a strong network and trusted relationships within the community. The church helped the hospital understand that many residents didn't trust medical professionals due to historical injustices.
That's such a crucial insight that the hospital likely wouldn't have uncovered without that community partnership.
Exactly. And together they developed a culturally tailored program that incorporated lifestyle changes, peer support, and even access to healthy food options through the church's food pantry. The results were remarkable, and it shows the power of truly listening to the community.
It highlights that community engagement is about more than just outreach or superficial partnerships. It's about building authentic relationships and working collaboratively to create lasting solutions.
Absolutely. It's about empowering communities to take ownership of their health, and that's how you create sustainable change.
I think it's a powerful reminder that healthcare professionals don't always have all the answers, and that sometimes the most effective solutions come from within the communities themselves.
Now let's shift gears a bit to another topic that was front and center at Vive cybersecurity. With the anniversary of the Change Healthcare cyber attack still fresh in everyone's minds, the sense of urgency around this issue was palpable.
I was struck by how the conversation has evolved from being purely reactive to a more proactive approach. It's not just about responding to attacks, it's about preparing for them before they happen.
right? And the emphasis was on vendor redundancy, not relying on a single vendor for critical functions. If one vendor goes down, you need a backup plan.
So it's like diversifying your portfolio. Don't put all your eggs in one basket.
Exactly. And it's not just about having multiple vendors, it's about having clear contracts with strict security clauses. You need to know exactly what your vendors are doing to protect your data and how they'll respond in the event of an attack.
There was also a lot of talk about having playbooks in place, pre-planned responses for different types of cyber attacks.
Absolutely. You don't want to be scrambling to figure out what to do when you're under attack. You need a plan, you need to practice it, and everyone on your team needs to know their role.
It all makes sense, but it also sounds overwhelming. Cybersecurity is such a complex and constantly evolving landscape. How can healthcare organizations even begin to tackle this?
It is a complex challenge, but there are resources available. Organizations like Shime offer information and tools on cybersecurity best practices, and there are vendors that specialize in cybersecurity solutions specifically for healthcare.
So it's about finding the right partners and making sure you have the right expertise on your team. You don't have to go it alone.
Exactly. Now, earlier we were talking about AI, and there's an interesting intersection with cybersecurity that's emerging. AI can actually play a role in proactively identifying and mitigating cyber threats.
How so?
Well, AI can analyze vast amounts of data to detect patterns and anomalies that might indicate an attack. It can also be used to automate certain security tasks, freeing up human analysts to focus on more complex threats.
That makes a lot of sense. AI can act as an extra set of eyes, constantly scanning for potential vulnerabilities and alerting security teams to potential issues before they become major breaches.
Precisely. And as AI technology continues to evolve, its role in cybersecurity is only going to become more significant.
So we've touched on health equity, community engagement, and cybersecurity, all crucial areas for healthcare organizations to focus on. But let's circle back to AI for a moment. I know we only scratched the surface earlier.
You're right. There's so much more to discuss, especially around the topic of responsible AI development. This was a major theme throughout Rive, and it's something that healthcare organizations need to be actively considering as they adopt and integrate AI into their systems.
What exactly does responsible AI development mean in the context of healthcare?
It's about ensuring that AI tools are developed and used in a way that is ethical, transparent, and accountable. It's not just about building cool technology, it's about thinking through the potential implications and making sure that AI is used for good.
So it's about being mindful of potential biases in algorithms and ensuring that AI tools are used in a way that benefits all patients, not just a select few.
Exactly, and it's about being transparent with patients about how AI is being used in their care. Patients have a right to know what role AI is playing in their treatment decisions.
This brings up the question of education and training. How do we ensure that healthcare professionals are equipped to use these AI tools effectively and responsibly?
That's a crucial question. We need to integrate AI education into medical and nursing school curricula. And it's not just about teaching the technical aspects of AI, it's about teaching the ethical considerations, the potential biases, and the importance of human oversight.
It sounds like we need a whole new generation of healthcare professionals who are comfortable working alongside AI and who understand the complexities of this rapidly evolving field.
I couldn't agree more. And it's not just about training new professionals. We also need to provide continuing education for existing healthcare workers so that they stay up to date on the latest AI developments and best practices.
That makes me wonder about the role of patients in this. Should patients be educated about AI in healthcare?
Absolutely. Patients need to understand how AI is being used in their care and what the potential benefits and risks are. We need to empower patients to ask questions about AI and to be active participants in decisions about its use.
It's about informed consent, isn't it? Patients have a right to know how their data is being used and how AI is influencing their treatment plans.
Precisely. The more we can educate patients about AI, the more comfortable they'll be with its use and the more likely they'll be to benefit from its potential.
This has been a really thought-provoking discussion so far. It feels like we've only just scratched the surface of what we learned at Vive.
I agree. There's so much more to unpack, especially when it comes to the evolving landscape of patient engagement and experience.
That was a hot topic at Vive and one we haven't even touched on yet. I'm eager to delve into how healthcare organizations are using technology to create more patient-centered experiences.
Let's save that for our final part. We'll be right back after a short break to wrap up our Vibe deep dive with a focus on the patient perspective.
Welcome back to 10-Minute Health Tech.
It's time to wrap up our deep dive into the Vibe 2025 Health Tech Conference.
Yeah, we've covered a lot of ground from AI and its implications to the critical focus on health equity and cybersecurity.
But there's one more key theme we need to explore.
The evolving landscape of patient engagement and experience. This was definitely a hot topic at Vive.
It seems like healthcare organizations are finally recognizing that patients are consumers too, and they have choices.
Yeah, they're demanding more personalized, convenient, and engaging experiences, and rightfully so.
Right. Technology is playing a huge role in meeting those demands. We're seeing a surge in tools and platforms designed to empower patients, like telehealth, remote patient monitoring, and personalized medicine.
These tools are giving patients more control over their health and allowing them to be more active participants in their care.
It's a fundamental shift in the patient-provider relationship, moving away from that traditional one-way street to a true partnership.
This resonates with what we discussed earlier about community engagement. It's about empowering individuals to take ownership of their health, whether it's through community-based programs or access to digital tools that enhance their healthcare journey.
Absolutely. And it's not just about the technology itself, it's about changing the culture of healthcare to be more patient-centric.
Right. That means really listening to patients, understanding their needs and preferences, and designing care models that put those needs first.
There was a great session at Vive on creating a digital front door for health systems.
Oh yeah, the idea is to make it easy for patients to access care and information online, whether it's scheduling appointments, viewing test results, or communicating with their providers.
Exactly. It's about creating a seamless and convenient experience for patients, meeting them where they are, which is increasingly online.
We also heard some interesting discussions about using AI to personalize the patient experience even further.
Yeah, AI can tailor health recommendations, provide 24/7 support through chat box, and even predict potential health risks.
It's fascinating to think about the potential of AI to anticipate our needs and proactively guide us towards better health outcomes.
It sounds futuristic, but it's closer than we think. AI is already being used to personalize care in some health systems, and we can expect to see even more of this in the years to come.
But even with all these advancements, it's crucial to remember that technology is just a tool, not a magic bullet.
Right? The foundation of a positive patient experience still lies in human connection, building trust, empathy, and understanding between patients and providers.
Yeah, those human elements are what make patients feel valued and respected, which ultimately leads to better engagement, adherence to treatment plans, and improved health outcomes.
While technology can certainly enhance the patient experience, it's the human touch that remains at the heart of quality care.
Well, I think we've covered a lot of ground in this deep dive into Vive 2025.
From the rise of ambient intelligence and the focus on health equity to the evolving landscape of patient engagement, it's clear that the healthcare industry is undergoing a period of rapid transformation.
Vive definitely provided a glimpse into a future where technology and human connection work together to create a more equitable, accessible, and patient-centered healthcare system.
It's an exciting time to be in healthcare, and I'm optimistic about the potential for positive change.
Thanks for spending 10 minutes with us, and be sure to look for more 10-minute health tech podcasts.